This month is dedicated to education and awareness on cervical cancer. I have with me a public health practitioner and National Under 40s representative for Medical Women's Association of Ghana. And her name is Dr. Oum-Kalsoum Zakaria Adam. Good morning.
Good morning.
And Happy New Year to you.
Happy New Year, many happy returns to
Awesome.
you.
Let's start right from the beginning. What is cervical cancer?
Okay, so cervical cancer is two words. We have cervical and then cancer. So cervical is from the cervix, and when we say the cervix is actually the mouth to the womb. Okay, and then cancer. So when we have changes in the cells within the cervix, that's the mouth of the womb, in the sense that they multiply uncontrollably, okay, then we say that we have cervical cancer occurring. So it's a mouth of the womb and then it's becoming cancerous.
Okay.
Yeah.
What are the main risk factors associated with cervical cancer?
Okay, so the risk factors of cervical cancer, most of them are habitual. So having multiple sexual partners, okay, or having a partner who has multiple sexual partners, okay, it's not necessarily you having the multiple sexual partner. That's one of it. And then also smoking can also be a risk factor. And then having an underlying condition that reduces your immunity, like having another sort of cancer, diabetes, or being immunocompromised from HIV. All of these are some of the risk factors that can predispose you to having cervical cancer, as opposed to somebody who doesn't have all of these risk factors.
What's the link between smoking and cervical cancer?
So it also reduces your risk, your immunity to a large extent, such that when you have the infection, that's the HPV infection, it leads to the fact that it can easily persist. You would have the infection persisting, then you end up having, and also smoking in itself can cause changes in your DNA.
Really?
Yes, smoking in itself can cause changes in the DNA, and then once you have changes in this DNA, that means that the stops and then the starts of cell growth may be manipulated. So in this sense, you tend to have cancer where the cells start to grow uncontrollably, and once you have things that cannot be controlled, we have danger. Yes, to a large extent. Yeah.
How does cervical cancer present? What are the signs?
So some of the signs, well, the whole point is that we are trying to get the education out there so that people are more aware of the fact that cervical cancer is real. And cervical cancer is caused by HPV virus, which is a highly preventable disease. Once you know that it can be caught early through screening, is very, very important. You would be able to go through the screening schedules for yourself every year, and then you'll be able to curb it. But some of the signs are that when these signs present, it means that cervical cancer is way beyond, it has advanced, and that is not what we want. But some of the signs could be that you may have abnormal bleeding. So abnormal bleeding, especially after sex, we call it post-coital bleeding, okay? Or you may have heavier menstrual flow than usual. It could also be that you have some foul smelly odor or foul smelly discharge, all from the cervix. And then it also depends on where it has spread to, which are some of the later stages. So if it has spread to your bones, you may have issues walking. If it has spread to your brain, it can spread to your brain, it can spread to your chest, it can spread to your liver. Depending on which part of the system it has spread to, then we can have symptoms related to that. And also most of the time, because of the excessive bleeding, they present with anemia. And then you notice that the person is cachectic, or the person has lost so much weight. So all of these things, no, we don't want to get there. So the message out there is let us, as much as possible, start screening early. Because sometimes some of these symptoms, you see them, or I'll say all of the time, you see them when the disease is well advanced, and we don't want to get there. We want to catch it early. We want to be able to screen, have our pap smears done, have our VIAs done, or our HPV DNAs done, and then we should be able to catch it early. Because you see, when the HPV virus is exposed, or you're exposed to the HPV virus, sometimes you're able to clear it, okay? But then other times it stays there for a very long time and then starts to cause these gradual changes, dysplastic changes. So within those years, which are sometimes it can take 10 years, sometimes it can take as long as to about 30 years. So at least it has given us this grace period for us to be able to do these swaps, for us to be able to tell that, oh yes, there are some changes that have begun, and then we can take care of it, rather than wait till it becomes this advanced, and then the prognosis becomes very, very poor at this stage.
Prevention is definitely better than cure.
Exactly.
When you are screening, what are you looking for?
So when you are screening, most of the time, you pass the speculum, and then I think we have a picture here.
Pictures?
Yeah, we
okay.
have.
So let's show the pictures up on the screen, and then you describe exactly what is going on. So
All right.
What is this?
So this is a speculum.
Okay.
Okay, so this is a speculum.
What does it do?
So most of the time, the vagina, we have the anterior wall and the posterior wall. Okay, so these two walls are closed together. So you use the speculum to open up the vagina,
okay,
which would help you visualize the cervix. Okay, so we need it most of the time during all the screening tests. So when you want to do a pap smear, you need the speculum, you need to pass it through the vagina. It's not painful. Okay, it may be just a little uncomfortable.
Is it made of plastic?
Yes, it's made of plastic.
Okay.
It's disposable as well.
Okay.
So it's used for
one speculum.
Yes, one patient for one speculum. So once you pass it through, and then you are able to visualize the cervix. When you visualize the cervix, then you can take some cells, or you can scrape some cells at the surface. You put it on a slide, and then it's taken to the lab for cytology.
Okay.
So in the lab, they look at the cells under the microscope to check for any abnormal changes or dysplastic changes, and then they also, if you need to do a PCR, that is also done to check for.
What's a PCR?
So the PCR is to check for the presence of the virus, which is the HPV virus, which causes the cervical cancer.
Okay. You mentioned pap smear. What is a pap smear?
So the pap smear is what I have just described.
The whole process?
Yes.
Okay.
The fact that, so the speculum is passed, the cervix is visualized, and then we use a brush or a spatula to scrape some of the cells at the cervix. Okay. Most of the time, I think I have a picture of.
There's another picture. Okay.
Yes,
so when it comes up,
let's
then you
see.
just describe for us.
All right. So once you scrape these cells, and then you put them on the slide, it's taken to the lab, and then it's visualized for cytology for any changes within the cells of the cervix.
Okay. So what is this? What are we looking at here?
All right. So. Okay, so this particular picture shows two things. So you can see on my left, that's a speculum that has been passed, and then the cervix is being visualized. Okay. But on my right, it's zoomed for us to see it properly. So this is not what we want to see. So this, you do not even need a pap smear to diagnose. You can see that. So a normal cervix is normally smooth, and then it's pink, all pink. But for this particular cervix, you can see that there's a whitish patch or a growth, an exophytic growth, meaning that this particular cervix is obviously diseased. You do not even need a pap smear to be able to diagnose this. Okay, and unfortunately, in this part of our world, in this developed world, most of the patients present in either at this stage or even further. You can see that it's gone beyond the cervix, and it's quite unfortunate. And
what's
the
the hope
reason
for the person at this level?
So it depends on the staging. You do not use just this to stage. You would have to do other tests as well. You check the chest, you check the other parts of the body for spread, and then you stage it appropriately. So we have different stages. So stage 1, stage 2, stage 3, and then we also have sub-stages. And all of these stages just tell us how advanced the disease is. And then it also helps us to know the kind of treatment to give. And also, it also helps us to know the prognosis of the particular case that we have. Okay, so depending on the stage, you can either have surgery, or you can have chemotherapy, or you can have radiotherapy, or a combination of all of these.
Okay.
Yeah.
Describe these images for us. So
this is also it's just showing how a pap smear is done. There's a diagram, so you can see that there's a cervix there, and then you can see the different parts of the cervix, that is the cells, where the cells are picked from. So a normal cervix, out there you can see a small hole. We call it external os. Okay, and that is where we have the squamo-columnar junction. Normally that is where cervical cancer begins from.
What junction?
Squamo-columnar junction. Okay, that is where cervical cancer begins from. So when you come, speculum is passed, you can visualize the cervix just like this on my left, and then you use the spatula to take some cells from the external os, as well as brush around it, around the circumference, to also get some cells from the whole perimeter, as well as the internal os. So this is just showing us how a pap smear is done. Really, it's not painful. So
how long does it take? How long is the whole process?
The whole process should take barely 10 minutes. Yeah, barely 10 minutes, and it's painless. I mean, a lot of ladies may be scared, because when they see the whole speculum and they feel like, you're going down there and all of that. No. It's painless. It may just be a little uncomfortable, but our healthcare professionals have been trained in such a way that they can pass it through the vagina painlessly. Okay, and then the cervix is visualized, and once the cervix is visualized, all the cells can be taken for the cytology to be done.
What's the recommended age at which a pap smear should be done, and how often should pap smears be done?
Okay, so most of the time, when you are sexually active, the assumption is that there's a likelihood that you may have been exposed to the HPV virus. Okay, so it is recommended that when you are between the ages of 21 to 29 years, when you are sexually active, you can start having your screens done.
Does that mean virgins don't need to do pap smears?
No, virgins don't need to do
pap smears.
Yes, okay. But we have different levels of prevention. We have primary, secondary, and tertiary. So the primary will take care of the virgins, where we have vaccinations. We have vaccines available for the HPV, which is recommended that even both the males and then the females can take the vaccine. So from 9 years to about 15 years, you can have the vaccine. And once you have the vaccine, it protects you against some high risk strains of the HPV virus. But it does not guarantee that you should not stick to your regular schedules, screening schedules.
Okay. And then so after you started, say, assuming you are sexually active, and you start taking doing the pap smear, how often do you do a pap smear? Once a year? Once every 2 years?
Yes, so for the pap smear, it's recommended that you do it every 3 years. And then sometimes it depends on what is found during the pap smear. So your gynecologist would either decrease the time to maybe once every year, depending on what was seen. But if everything is fine, every 3 years, it's recommended every 3 years you have the pap smear done. And then for the VIA, so we have different modalities. We also have VIA, which is visual inspection with acetic acid. So for that, you just pass the speculum, and then you visualize, and then you use what we call the acetic acid around the cervix, and then you can see visually if there's any whitish patch. You can actually see it visually and then treat it there and then. That's another modality of screening that is done. It's actually cheaper than the pap smear.
How much is the pap smear?
The pap smear for now is about 150 cedis.
Is it a National Health Service?
No, unfortunately.
But that's
exactly.
That
so that is one of the things we are advocating for, so that all stakeholders would come on board and then make sure that at least it is covered under the National Health Insurance Scheme, so that now all ladies can go out there and have it. Because actually, in the developed countries, they actually have it. And ladies are actually called
to come and
anytime,
take their pap
smears. But unfortunately, Here in our developed world, we do not have that.
What's the mortality rate for cervical cancer?
So mortality rates for cervical cancer in Ghana, yearly, you have about 3,000 plus of people, of ladies who are diagnosed with cervical cancer yearly. And out of that, about 2,000 plus end up dying.
No way.
So it is highly, it has a very high mortality rate.
Yeah.
And it says that
Two out of three.
Yes, and the thing is that it can be prevented. It's a cancer that can be prevented. So why do we have to die from it? Why do we have to die from it? We don't need to die from it. We need to make sure that we start screening, we start going out there, and then we screen, we get educated, and we take the responsibility onto ourselves as ladies and make sure that we have our pap smears done as scheduled. Okay, and back to the screening schedules that we're talking about. So aside the VIA, which you can also do every 3 years, we also have the HPV DNA. So the HPV DNA, you actually go and then look out for the presence of the HPV virus. So for that, you do it every 5 years.
Okay.
So PAP, VIA 3 years, and then you have your HPV DNA every 5 years.
And this HPV virus, does it discriminate? Is it found only in women or it's in men?
No, so we have about over 200 strains of HPV. But over 40 of them are sexually transmitted. And we have, research has shown that we have the high risk ones and then the low risk ones. So like the HPV 16, 18, most of them are the high risk ones. And they cause about 70% of cervical cancer. And then the low risk ones, we have HPV 6, HPV 11. And these ones cause other forms of disease. So they can cause genital warts, and genital warts can affect both males and females. Yes, but cervical cancer affects females because obviously they have the cervix, exactly, to a large extent.
Well, you're watching GTV Breakfast. We're looking at cervical cancer. It's generally dedicated to awareness on cervical cancer. My guest is a public health practitioner, Dr. Oum-Kalsoum Zakaria Adam. She's a national under 40s representative for Medical Women Association of Ghana, and we're looking at just education on cervical cancer. If you have any questions, you can send them to us on our WhatsApp 055-556-1034. So let's just run through the treatment options available as far as cervical cancer is concerned, and what your organization is doing to help ladies across the country get more awareness and education about cervical cancer.
All right, so the treatment options for cervical cancer are surgery, radiotherapy, chemotherapy. So depending on the stage, as I said, we have different stages, stage 1, stage 2, stage 3, and then sub stages as well. So depending on the severity of the stage, these options are available for you. But we don't want to get there. We want to catch it early, because once you catch it early, you'll be able to nib it in the bud, okay, so that it doesn't get to full-blown cancer. All right, so what my organization is doing, Medical Women Association of Ghana is an association of all lady doctors across the country. So cervical cancer affects women. And over the years, who are the better people to talk about cervical cancer than women themselves, because we get affected by it. So we have taken on the mantle to be able to talk about this cervical cancer and then make sure that we get as many women educated about cervical cancer. So over the years, what we do is that we have face-to-face education at social gatherings like churches, schools, mosques, tertiary institutions and what have you. We talk to people, we educate them on the need, or on what cervical cancer is, and for the need on they having their regular screenings done. Also, we do social media activations where every day we have a message on cervical cancer where we put on our social media platforms, so that once you get, at least within the month of January, you get to know something about cervical cancer, and then that would help you reflect and then make sure that you go for your screenings. Another thing we do is, thankfully, we have Lexstar, the producers of YAS, collaborating with us and supporting us over the years. For the past 5 years, they have actually been our partners, and they help us a lot in having or help us for us to be able to tell the world or educate people or have education across the country. So in all regions, not only Accra. Okay. So all regions, we have lady doctors out there who are talking about cervical cancer, who are screening people about cervical, who are screening people for HPV and cervical cancer as well. So this year in Accra, we are going to have about 150 women screened for cervical cancer free of charge, and that is to be done in Korle-Bu Polyclinic. So over the past years, we select particular regions or we select particular groups, vulnerable groups, and then we screen them for cervical cancer free of charge, and then we also follow up on them.
When is the screening happening?
So it's actually started.
Okay.
Yes. So you can find your way to Korle-Bu Polyclinic if you're in Accra, and then you can have a VIA done for free. The other regions are also doing other activations, and I'm sure we would share all of that on our social media platform. And we'd also have a launch or a climax of the whole exercise. The details will be available soon once we finalize on the group we would do it for.
Okay, let me just check out. I think I have a message on this particular topic for you. Are there any myths surrounding cervical cancer?
Sorry?
Any myths, any ideas that you want to tackle?
Maybe the whole thing is, people may think that, when you have a pap smear, it's painful, and you may rather tend to predispose yourselves to having the cancer. But that's not true. It rather prevents you from getting cervical cancer.
What would you leave our viewers with respect to what they need to do to prevent this? We don't want it to get to the stage where it's cancer. So what are the key tips people must know?
Ladies out there, let's make sure we get ourselves educated on cervical cancer. Let's practice safe sex. Let's avoid avoiding multiple sexual partners, and if we need to abstain, we abstain. Let's be faithful. If we need to use condoms, let's use the condoms. So that's basically practicing safe sex. And then the other thing is that if we are sexually active, please let's come out there. Let's start visiting our gynecologist, and let's make sure that we are on a particular screening schedule and we follow it throughout our lives. And then for the young ladies or for the young boys and girls, let's get them vaccinated. Thankfully, there are vaccines available that we can vaccinate against the HPV virus, which gives us protection actually up to about 10 years.
Just every 10 years and you take a vaccine?
Yes. So it gives us protection against some of the high risk strains, as much as possible. So yes, basically those, and then I'm sure we should be fine.
What's your theme this year?
So it's still cervical cancer. We don't have a particular theme but it's massive education. Get screened, get vaccinated, and get informed.
All right.
Yeah.
Thank you so much.
Most welcome.
And all the very best.
Yeah.
With the
and
education.
then one last thing, I would want to say a very big thank you to YAS for collaborating with us and then helping us to get this message across to everybody across Ghana, and then also to GTV for having me this morning. Thank you so much.
It's a pleasure.
Yeah,
we're happy to have you here.
Thank you.
I can see Yaz and Lexstar on your t-shirt, so shouts to them.
Yeah.
All right. My guest has been Dr. Oum-Kalsoum Zakaria Adam. She's a public health practitioner, national under 40s representative for Medical Women Association of Ghana, and OMFS resident at the Korle-Bu Teaching Hospital. And if you want to check out this conversation again, please go to our Facebook page.